to provide a world-class support and information experience to all residents, that is, indigene or foreigner in Nigeria, on HIV and AIDS and other related diseases, is the mandate of the National Call Center for HIV and AIDS and related diseases. Hello and welcome to this episode of The Last Mile with NACA. I am Ade Suwasi. Officially commissioned in 2012, the National Call Center for HIV and related diseases, domiciled in the National Agency for Control of AIDS, NACA, was created to support the objectives of the agency. To effectively execute this mandate, the unit is constantly leveraging innovative strategies and technologies. You're watching The Last Mile with NACA.
Welcome to National Call Center on HIV, AIDS and other related diseases. My name is Aisha. May I help you?
Everyone who needs more information about HIV services, either prevention services or treatment services, is welcome to call our call center at 6222.
The National Call Center for HIV and related diseases such as tuberculosis, hepatitis, malaria, and sexually transmitted infections was born out of a public-private partnership between the National Agency for the Control of AIDS, NACA, and major telecommunication companies in Nigeria, which aims to help decrease HIV infection rates, especially among youths, through the increased knowledge of available intervention options.
In April 2012, the call center came into establishment, basically to help provide information, reference services, HIV counseling to callers who call into the call center in order to get any of this information. It is a center that is open to everybody in the country and even outside of the country. So people call into the call center to seek information on HIV/AIDS, whether it is prevention services, whether it is treatment services, whether it is specific areas like prevention of mother-to-child transmission, discordant couples, whatever questions you have that will have to do with HIV/AIDS, you can call the call center and somebody will be there to answer you. We go as far as related diseases like Ebola, TB, malaria, even the COVID-19 pandemic. People can call in and seek information. Our agents are trained to answer questions in these areas. The call center has the scope of taking multiple calls at the same time. There are agents in the call center who work from 8 a.m. all the way to 8 p.m. every day, except on public holidays and on Sundays.
Barka da zuwa cibiyar kiran kasa akan HIV/AIDS da cututtukan masu alaka. Sunana Zakari, ta yaya zan taimaka? Barka da warhaka. To Malam Ismail, ta yaya zan taimaka maka yau? Okay. To ba kuma kana son ƙara ma bayani akan cutar HIV ko?
The call center operates using a toll-free line, the line assigned by the National Communications Commission, 6222. And anybody who has access to mobile telephony can call the call center. Let me also state that the toll-free line is not for all the mobile networks. We basically partner with 3 telecommunication companies, networks, MTN, Airtel, and 9Mobile. Well, if you use Glo, you'll be charged in the normal way that Glo charges. But the 3 other networks you can call and it's free. The call center operates using the E1 line, which was provided by one of the telecommunication networks. And this is a line that enables callers to call and interact with callers, whether they are on seat or not on seat. So callers can also have access to information even when agents have closed for the day. So we have the IVR, the interactive voice response that gives feedback to callers depending on what you want. You can access information even when the caller is not, the agent is not on seat. and then the agent come back and they have your recorded responses and your interaction with the system in their database, and they can access that.
In 2018, 40% of HIV infections in Nigeria occurred among young people ages 15 to 24. Only 34% of young men and 43% of young women are fully aware of how to prevent HIV. To address this, NACA is intensifying efforts by exploring new communication technologies.
The basic channel through which people can get to the call center is by calls. 100% for now is by making calls and talking to the call center agent, or accessing the self-help service of the call center. We are doing everything possible to enhance the operations of the call center, and so that leads me to the partnership we are also trying to have with this initiative that is brought up by NACA in collaboration with UNICEF, the U-Test. The U-Test is an innovative platform, an innovative intervention for HIV programming among adolescents and young people. Basically, what does it do, and where does the call center come in here? In the U-Test platform, young people and adolescents have access to accessing services of their choice using that platform. Maybe gender-based violence, maybe access to PrEP, pre-exposure prophylaxis, access to treatment, HIV's self-testing, counseling or referral, whatever service he wants, they are all in the U-Test platform. So they have a drop box, and one of the services is the call center.
So we're developing a national HIV prevention campaign for adolescents and young people. So actually it's beyond a campaign, it's a program. And we've also identified areas where the call center operations will need to be tweaked a bit. So we're going to put hands to work with them. So for the whole U-Test, we have the youth engagement component, we have the digitization component, we have the social, the communication strategy and social media campaign component. Then we have the service provision, which has to do with community service and referrals to facilities. Then we also have the coordination, which takes care of coordinating the whole work with the leadership of NACA, coordination and sustainability, using the guidelines and tools that are national, so that everybody keys into it. And then the bigger framework of knowledge management, documentation, MIE, knowledge management, because whatever we're doing, we have to document it very well so that we can learn, and then we can use the information and learning to feed back into the system and get better. We're really going to be depending on different groups of people, young people, people in the industry that have innovative ideas. We want to disrupt the ecosystem, want to do things differently, and want to change the narrative about Nigeria.
How does the U-Test platform work?
The schematic has a user journey that takes you from a social media campaign, which will run on the NACA website, the Facebook, the Instagram, the Twitter. So a lot of creatives, a lot of engagement and traffic will be driven on that campaign, and that will drive them to the next spot. And the next spot is a chatbot. And on that chatbot, there will be a lot of options of what you might want to do. So one important feature of the chatbot is that there will be a self-risk assessment test. And that self-risk assessment test, when they click on it, it's going to ask them questions about their sexual behavior and other risk behavior that might expose them to HIV. So after doing the self-risk assessment test, then you now be referred to do a HIV self-test. And we're trying to make the platform as user-friendly and as low cost as possible, so that this easiest phone, simple feature phone, will be able to go through this user journey.
There is also a component of the U-Test platform that affords youths the opportunity to earn and make a living.
An important aspect of this the U-Test platform is YOMA. YOMA is Youth in the Marketplace. It's a platform that UNICEF has set up. It's a digital platform for driving young people to engage in learning and earning. So there's the concept of social impact tasks. So young people are encouraged to come online, because when people are online all the time, they're digital natives, as they say. So they're doing a lot of things. So we want them to use their time online wisely and for transformative activities to learn and to earn. So we're having partnerships with different sectors, with different companies that will offer, as part of their corporate social responsibility, some of their training packages that otherwise young people will have to pay for, and it will be one of the things they'll get as incentives. So what we are saying is that when young people go through this UTEST user journey as an incentive, because we want as many of them to come online as possible, as an incentive, they're going to get some points, which they can accrue, and at the end of their journey, they're able to claim from UMA.
NACA places a premium on training and retraining of its staff, and the National Call Center agents are no exception.
All of us, no matter where you work and what you do, we cannot overflog or overemphasize the importance of training. We need to get highly professional and skilled in what we do at every given time. The call center is no exception, and we take training as a very, very important aspect of the call center operation. For instance, within the last month or so, we have had the call center agents trained twice. We had them trained on HIV self-testing. We also had them trained like 2 weeks ago or so on excellent customer service. And so from time to time, we just interact with our call center agents to find out what exactly is a burning issue that they need their capacity to be built on. And then we take that, and our DG has been very generous enough in this regard to accept our concept when we put up any concept that has to do with training of the call center agents. So if the call center fails, the NACA fails. It's the face of NACA. So we don't take it as a joke. So whatever we can do to make sure our agents are well equipped and their capacity is built optimally, we try to do that. And so training is something we take very serious, and we give it. Definitely a quarter cannot pass without us training our call center agents in one aspect or another that will enhance their proficiency and effectiveness in work.
No, about National Call Center, Barcelona, HIV is on your dozo. I found Chidi, good thing is in the okay. I forgive weekend na KB Sabo.
Kilo require lẹ́kọ̀ọ́ sí bulletin pé wá. Okay, ẹ tó bí ọmọ ọdún mélòó? Okay, ṣé ti ṣe àyẹ̀wò HIV/AIDS rí?
Special issues regarding prevention of mother-to-child transmission and human rights violation are also handled by the call center.
Apart from the traditional direct, when you talk about HIV, what comes to people's mind first, you just test and know your status. Let me go do my HIV test and then know whether I'm positive or not and all of that. But I also briefly tried to say that the call center handles other special issues like PMTCT, prevention of mother-to-child transmission. In the issue of stigma and discrimination, which is a very big issue, you can call the call center and seek redress and tell your story. Where has it happened? What happened? Who did this to you? Whether it is gender-based violence that takes place, call the call center. You are discriminated upon or stigmatized, call the call center. We will have a way of getting your issue redressed. So we have departments in NACA that handle this. And the chief executive of NACA, the DG, anytime he's on air or anywhere he finds himself talking about HIV/AIDS, he stresses this. He always stresses this, that a law has been passed. If you discriminate against anybody or stigmatize anybody, the law will catch up with you.
Support NACA in the fight to attain HIV epidemic control by 2030. Call 6222 today.
Welcome. This is the National Call Center for HIV/AIDS and related diseases. My name is Ncch. How I want to help you.
My country people, something dey. E get one number wey I wan tell you now, and this number wey una go see so, I wan make una use am. This number so na for to get all the information wey you need for HIV and AIDS. You no need to go internet go dey read. This one you fit come say you no get data. Na im make you no fit get information. If you die 6222, they no go charge you anything. Any kind of question wey you wan know for HIV, any kind of question wey even malaria and TB sef, they go sure answer you one time. And the time you go use call na 8 a.m. to 8 p.m. Abeg, make nobody carry last for this kind of thing. 6222.
What we want people to know is that there is an act against HIV stigma and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a number one enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
This HIV self-test kit has been certified safe and effective by the WHO, Federal Ministry of Health and NACA. For more inquiries, call the NACA Information Center free of charge on 6222. Do not eat, drink or use mouth cleaning products 30 minutes before the test. Find somewhere private with good light and a flat surface. The kit includes instruction leaflets that should be read carefully, a test stand and a sealed package containing a test device, developer tube and preservative used for storage only. This is not needed for the test. Open the test tube and place it in the test stand. Grab the test device by the handle. Do not touch the flat pad. Apply moderate pressure while swabbing the flat pad once along your upper gum and once along the lower gum. Immediately put the test device in the developer tube. Leave it there for 20 minutes before reading the result. Do not read the result after 40 minutes. Test is positive if both control and test lines appear, in which case you should contact NACA Information Center as soon as possible for advice on the next step. Test is negative if only control line appears. Test is invalid if there are no lines or only test line appear or the wipe result background becomes red and should be repeated. Properly dispose all contents in the normal trash. Support NACA and the fight against HIV. Know your HIV status today.
It is said that when you seek, you will find. So, ask the National Call Center questions on HIV and related diseases. You shall definitely get answers. Our update segment is next. Don't go away.
The Independent Corrupt Practices and Other Related Offences Commission, ICPC, has inaugurated the Anti-Corruption Transparency Unit, ACT2, at the National Agency for the Control of AIDS, NACA, to serve as internal mechanism for effective implementation of programs. The chairman of ICPC, Professor Bolaji Owasanoye, represented by Charles Nwosu in his address, said that ACT2 was an initiative of the Commission and approved by the federal government.
Since the ICPC cannot be in everywhere, there's a need for a unit called ACT2 to be in LND. So the board of the commission adopted and write to the Federal Executive Council, which approve it and send a circular, order the Office of the Head of Service of the Federation to issue circulars to all MDAs to establish a unit called ATU.
According to him, it was to serve as an in-house check mechanism for corruption prevention within MDAs and public bodies, and not a tool for ACTU members to witch hunt other staff. High point of the occasion was the taking of oath of office by the members of the unit, administered by a lawyer from ICPC.
Do solemnly affirm
they go like this now? Take am easy now.
Na hospital I dey go to do HIV test.
Na everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o. During pregnancy or labor, or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sen ten ce. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols, wear a face mask, and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as always, continue to support the HIV response. Do not stigmatize or discriminate against people living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week on The Last Mile of NACA, I am Ade Wellesley. Goodbye.